Thank you, everybody, and thank you also to Sarah and I'm so sorry, I've forgotten Jan. I can't remember and our previous speaker. It was really interesting to see your journey, your journeys, and so I want to talk to you about our journey with continuity of care from in Barnsley Hospital. So for the benefit of everybody who doesn't know where Barnsley is, it's obviously a town in the north of England. We are a town where historically there have been it's a mining community. There are high levels of deprivation in our community, and high levels of smoking, obesity and heart disease, and also high levels of real sort of social challenges and safeguarding, and you know, our families, as all families up and down through England and everywhere else the world, deserve the best care, and you know, being head of midwifery in an area where deprivation is so prevalent, I'm really passionate that women and their families and children get the best start in life to allow them to fulfill their potential. So I'm very passionate about continuity of care and the women's, you know, the right that women have for choice and personalisation of their maternity care. And for some women, you know, this is the only time they will be cared for and have their needs put first. So I want to make sure that we do it really well. Next slide, please. I don't think that's great. So I'm trying to be really quick here because I know we're overrunning a little bit. So our journey. So I started as head of midwifery in 2018, and it became very apparent, having started in a new unit, that I wanted to really revitalise midwifery as I saw it. And looking at the evidence, I also wanted to implement continuity in the service in a really deprived area that would improve outcomes for mothers and babies. And so I was very lucky to work with a senior midwife called Kerry Bushell, who was equally as passionate about continuity, and now leads as matron for antenatal services and community for all things continuity in Barnsley. And she really has pulled all the stops out for us, and we're very, very grateful. So we had the first engagement meeting, because obviously you've got to be in it to win it, and we needed to get talking to our workforce to say, this is what's coming, this is what we want to be part of, what ideas do you have? Because ultimately, if we don't get the ideas from the staff, front-facing clinical staff on the ground, it's not going to work if they feel done too. So the first meeting we had was July 18, and to be fair, the only people that came were the people to tell me and Kerry all the reasons why we couldn't do this and why it wouldn't work, and we wouldn't be able to do it. And so we started from there. And to be perfectly honest, the only way was up from there. So we looked at engaging with staff to get their ideas about how it could work for them. So our teams, we have 4 teams, continuity teams, and they're all named after gemstones. These were midwifery ideas. They wanted, I was very happy for them to look at who they wanted to be. How they wanted to be known. We have a closed Facebook group, and so we did lots of negotiating on there in a closed area of how we were going to introduce continuity, what it could look like, what it would mean for them, work-life balance, what would that mean. And the first team came together themselves, and they're a geographically based model of mixed risk. All our teams are of mixed risk and are a fully on call model. So I'm definitely not going to sit here and say to you, everything was absolutely perfect, tickety boo, because it definitely wasn't. It still isn't. Is it perfect now? No, it isn't. But what I am always saying to my teams are that don't be afraid for things not to go perfectly to begin with, because most things don't, and learning tends not to be linear. and I'm really interested in how people learn and how our teams learn to work together. So Emerald team launched, and it has been an incredible success, I have to say. And we quickly thought we need to sort of gather momentum here and get the next team out. Things weren't quite straightforward, and it took until December 19 to get the second team established, and we really had to continue engaging and negotiating with the workforce to look at what this could look like for them. And to get people on board, we let the midwives decide how it could look for them within the parameters of continuity. And so they wanted to have they were looking at a sort of a mixed base model that wasn't totally on call. So there were two midwives who worked long night shifts, and the other 2 days they'd work in community, and then the rest of the team of 8 would be working in an on-call. So Ruby launched, and their levels of continuity and obviously satisfaction for mothers and their families was incredibly good. Then we launched the third team in March 2020, which absolutely coincided with the pandemic. So Sapphire team launched, and it was a very similar model to Ruby, quite a sort of a hybrid model. And with the pandemic launching, what we really didn't want to do was to say, right, we're hitting a really tough time, we don't know what's going to happen with the pandemic, I think we're going to pause or stop continuity, because during hard times, that's when you actually need continuity. That's when you're actually going to get the better outcomes, make maternity care safer. So we sort of paused Sapphire team. We kept going with Emerald and Ruby, and we paused Sapphire, but we kept our band 5, there was one band 5 midwife who we kept out in community to upskill. And that worked really well. And the team still had lots of contact with each other and built relationships within the team. So when they were re-established in September 20, they had a real sort of, they had a bit of an advantage in that they'd had practice speaking to each other, talking about rotas, working together. So September 2020, Sapphire was launched. May 21 is our latest, our 4th team, Amethyst. And Amethyst is it's funny, Amethyst, they're like my children. Amethyst are like Emerald. They got themselves together. They really sort of worked. They sort of presented themselves as a fait accompli. We want to do this. This is how we want to do it. It's, again, like all the mixed risk, geographically based teams. And so they're a fully on-call model as well. One of the things I would know is that the Ruby and Sapphire, there are sort of very similarities in some of the issues that presented within those teams. And one of them was that the individuals that worked the shifts often felt a bit excluded. I suppose that's a bit of a strong word, but the relationships in the teams were more complex, and there was a lot more discussion, perhaps over the WhatsApp that the teams would have. That our band 7 team leaders really had to sort of go in and unpick probably some sort of small team relationship issues that cropped up mainly in those 2 teams, but didn't appear as apparent in Emerald and Amethyst, which were totally on call. So I felt that was interesting. Next slide, please. So the next slide is just a quick one, and it's just basically, it's Kerry Bushell did the continuity bus, and she was looking at this is when we were trying to get lots of interest, and we likened it to getting on the bus or staying at the bus stop, or are you going to miss the boat, that type of thing. So this was something that we put on, we shared with staff prior to coming to the engagement meetings. And I think it was an interesting analogy, and it made people laugh a little bit, and we all need a bit of a laugh sometimes, don't we? Next slide, please. So yeah, the next slide shows our sort of stats dashboard for this year. And you can kind of see in May, we had our continuity got up to 55.4%, obviously with the sort of women coming over prior to 28 and 6. And then as Amethyst embeds, really, you can see that we sort of like start dipping down again at 47.2%. One of the interesting things in Barnsley is that we have about 15 to 20% of our women that come and actually want to come and have their care in Barnsley, but their GPs won't necessarily be Barnsley GPs. So some of our continuity figures, we obviously can't include those women currently because we can't provide continuity because they're getting it in from other providers antenatally and sometimes postnatally as well. So that does impact on our continuity levels to a degree. But I think as we move to sort of more system-wide working, hopefully we can look at actually, all women having the opportunity to have continuity, even and having the choice of where they want to birth as well. Next slide, please. So this is our latest submission to our South Yorkshire and Bassett Law LM&S, where we receive a lot of support, and we're very fortunate in South Yorkshire and Bassett Law that our head of midwifery mainly on the same page, and we do really try and collaborate and agree on our sort of system-wide strategies. So we are lucky with our LM&S there. So we can see all 4 teams, and currently we're at 52.74% continuity, and you can see at the bottom there that we're delivering 44% for our women living with with high levels of deprivation, and 46% of our BAME women are receiving continuity as well. So we made sure that when we were looking at our teams that they were based in the areas of high deprivation and also where our BAME community were. We actually have quite low levels of BAME women in Barnsley. However, we could identify where those women were living and where their GPs were. So currently we're doing okay. We've still got lots of work to do, but we really, really are passionate about continuing our journey. Next slide, please. So the learning, there's plenty of that. So we continue to learn all the time. We continue to not get it right and then return back to the basics. We've had lots of support, obviously, from Tracey and Claire and Tracey, and it was just fantastic because we love showing off in Barnsley, having NHSEI come in to do an assurance visit with us at the beginning of September, and it still gave us lots of food for thought, even though, we're doing pretty well at the moment. We found that the autonomy presented to midwives, particularly younger midwives, not younger in age, but more newly qualified midwives, the flexibility that this allows and also the increased autonomy can sometimes be really anxiety provoking. So we are, as Sarah said, working with Jan Smith, who is providing a programme across the system of some psychological support to look at supporting all of our teams separately. Each team, not just continuity, but each team of grades of staff, labour suite coordinators, people who work in the day unit, antenatal clinic, the ward, they all have their different views of continuity. And when the going gets tough, and we've heard, obviously, and we've experienced exactly the same when recently in the last 3 months have probably been the hardest I've ever experienced as a midwife, and particularly as a head of midwifery, in terms of staff being very anxious, scared, upset, generally concerning staffing and workforce numbers. And one of the things I have learned is that actually unless you've got your workforce right, unless you've got your most recent birth rate plus assessment and you are your establishment is funded for this, you're not likely to be successful unless you have got the right workforce. They would be my takeaway thoughts here. Engagement with teams, we're always trying to engage with teams. Sometimes we do better than others. Obviously challenges with COVID, and creating an environment where innovation continues and grows, and people think about doing things really differently. To engage with continuity is always vital. One of the challenges for me, all things digital. One of the things that I hadn't absolutely acknowledged really is working off site. So making sure that midwives are able to have connectivity to the whatever electronic patient safety electronic record you're using, and to have a maternity specific electronic record. So as a system, we're absolutely committed to having one record across the system to promote safe care and safe communication, and that is absolutely vital. But you can have the best record, but if you can't connect when you're off site, if the infrastructure is not there, that's not really going to help you. Next slide, please. The future. The future. So this is, we're looking at probably 7 geographical teams based on our 3,000 births, we think. And we're really excited to look at this. And, we've got this sort of, as Mel Hudson always says, we need to think about flipping the service. So I think about that a lot at 4 a.m. All our new midwives to the trust are now on integrated job descriptions, and they understand they will be joining future continuity teams, and that will be our default model for maternity care. And a rolling program of staff engagement and events in preparation of rollout for new teams, and also to sustain innovation and engagement with the forward trajectory. So at the moment we've decided that, given this position that we're in, we're going to actually enter a period of stability, not pause, stability. We're carrying on with our 4 teams for the next 12 months, and we'll be looking at our 5 and 6 teams perhaps this time next year. And this will allow, I feel, our staff to settle and grow within the teams that they're in, and we can sort of make and mend and look at supporting our staff in the new world, because that's where we are, we're within the new world. Next slide, please. And never the end, just the beginning. And there's just more of the same exciting stuff. And I'm always really excited about continuity and about improving outcomes and early suggestions. Outcomes. We have less term babies being admitted to the neonatal unit. We've had dreadful breastfeeding rates in Barnsley. Traditionally, we used to run at 58, 59%. We're consistently sort of like 65, 67%. And I know that's not where we need to be, but 10%, there's 10% of our babies being breastfed. There's what's not to like. And smoking cessation. So we had about 25% smoking at delivery rate, and we're down now to about sort of 13, 14%. So it's all good. It really is all good. So really happy to take any questions. I'm sorry if I've rambled on.
Thanks for watching this video from the Maternity and Midwifery Forum. For more expert opinion and analysis, hit the button below to subscribe.